Hello and welcome to Business of... Earlier this week, I caught up with Vishal Bali, CEO of Wockhardt Hospitals, to get his views on the Indian healthcare industry. He sees no signs of slowing down, but says growth rates this year will be slower than last year.
I think it will probably not grow faster than last year. I do not see it slowing down. I definitely see it continuing to keep pace as it did last year. And so irrespective of the fact that, because of the financial crisis and because there is huge income erosion which is happening on one side, I do not really see that impacting and slowing down the growth rate of the Indian healthcare sector. Everybody has looked a lot more inwards. Everybody has looked at, what kind of new spaces are emerging. Everybody has looked at in terms of not just looking within the country, but what kind of opportunities are existing outside of the country. So if I were to, just sort of put it together, then there are definitely, new markets are opening up. Obviously the tier 2 activity within the country is still at its very nascent stage. And, the opportunities which are there right now in the semi-urban locations and for patients from those locations to receive healthcare in the urban cities because healthcare does not exist in those cities. I think one has to really move a lot more aggressively inside those market spaces and try and create opportunity out of that. In corporates, particularly in the private corporates and the public sector corporates, a lot more work is being done with the human resource managers, with the benefit managers to basically see as to what can be done so that they really don't get impacted by their rising healthcare costs. And what are some of the new preventive strategies that can be done for their employees and their families so that a lot more healthcare focus still continues to be there, but not at huge costs. Then lastly, I think in this entire context of, medical value travel, international patients coming into India, I think we've done a lot more work even in that space to sort of ensure that India continues to be a dominant healthcare destination for international patients. So I think very clearly speaking, new domestic opportunities, new international opportunities, new opportunities revolving around how one can interface with corporate India to basically create better healthcare services for them.
You talked about the opportunities. What about the challenges for the Indian healthcare industry, especially in the last 6 months?
Not as an organization, but when I look at the ecosystem around, and when I look at the corporates around, when I look at the employer groups around, definitely there is, they have been stressed. They are looking at as to how they can reduce their costs. They have been pushing back on some of the insurance products for their employees and their families. Those are definitely challenges, and because, particularly if you look at the South and if you look at, Bangalore and Hyderabad and to some extent Chennai, the entire IT industry has been, which is a large dominant employer group here, has definitely got impacted in a big way, and they want to reduce their healthcare costs. So I think these are some of the challenges which have emerged, and one is looking at trying to see as to how these challenges can be combated. I think the opportunity in India to a very large extent also arises from the fact that India is such an underinsured country as far as healthcare is concerned. And if we look at the last couple of years, health insurance has been growing at a very fast pace, to the tune of almost about 50% in terms of their premium growths. And I see that trend as a huge opportunity because, if you, in a recessionary trend, if one can continue to increase the number of people who can fall under the insurance bracket, then you have created a much larger market size which can afford healthcare in this country. So, and I think that's another reason as to why we are not really seeing a recessionary trend impacting, because insurance is growing and that is creating a totally new market opportunity.
Vishal, take us through the opportunity in the tier 2 cities, especially in the South.
I think the tier 2 cities are the cities where markets need to be created. If you fundamentally look at the flavor of a tier 2 city, if you fundamentally look at its composition, then the number of people who were going to the larger metros and getting themselves treated was probably 30% of the number of people who were actually getting diagnosed to go and get treated for certain disease segments. So what is really happening is that currently, if you look at any tier 2 city, probably only 30% of the patients who are diagnosed in those cities are getting treated. There is a large 70% pool which probably never gets treated at all. But the drivers around that 70% is that when you go and create a facility in those cities and in those markets, then you need to really work with the community in those markets to make them understand that here is a hospital and here are services and facilities which are equally good as you would find in any other metro. So that's why it takes a little bit longer to convert that market segment and to basically evolve that market segment into becoming a consumer for these high-end services.
Vishal, many people have talked about India becoming a healthcare hub. Do you see that becoming a reality?
There's a huge opportunity, Bala, in terms of creating India as a global healthcare destination. We have huge challenges in this country as far as basic healthcare services are concerned to the larger part of our population. But, you know, when you look back and when you look at various industries and various sectors and how they have contributed at a global level out of India, you know, IT being one of them and so many others, you know, which have really made India a dominant force in the global community. I think India offers a similar kind of an opportunity through its healthcare services. So the question is, if Made in India is making us proud in so many other fields, can Treated in India not make us equally proud in the field that we are in, that is in healthcare services?
That's all on this edition of Business of South. Keep learning, keep watching UTVI.